In the yesterday class, we will be discussing about the blood supply of the brain. So today we will be discussing little more, and at the end we will be also I am giving you one quiz. So in our brain, there are two major artery who do blood supply. One artery is supplying 80 part of the brain, anterior 80 part of the brain is supplied by one artery, and one another artery is supplying the 20% in this back part or the 20% part of the brain. So the 80% supply by one artery and the 20% blood supply by the another artery. So in this way, the two arteries together are supplying entire brain. So now first I will discuss the name of these two arteries. Then we will be discussing how this artery is coming, from which path they are entering in the brain and all. So let's see here. So the percentage of the brain supply. One is the carotid artery who supply 80%. Another is the vertebral artery, means vertebral artery means coming from the vertebra, from the spine side, from the back side, supplying 20% part of the brain. So the carotid artery, or we can tell internal carotid artery, supply the anterior part of the brain or doing anterior circulation, and the vertebral artery or the vertebrovascular artery supplying the posterior part of the brain or doing 20% blood supply. So internal carotid artery and the vertebrovascular artery. So we can see here, suppose if this is the brain, I am making the brain so you can understand we are dividing brain in three parts: anterior, middle, and posterior. So the anterior and middle brain is supplied by internal carotid artery, and the posterior brain is supplied by vertebrovascular artery. So this is total 20% blood supply, and this is total 80% blood supply, because this is the very big part of the brain. So it's written here, internal carotid artery supply 80% of the total cerebral blood flow. So this anterior and the middle part. And the vertebrovascular artery supplying the 20% of the total cerebral blood flow, means this posterior part. Right? Okay. So we can understand again in this way, very simple way. So suppose this is the brain. So anterior part of the brain, middle part of the brain, posterior part of the brain. And the other name of the brain, we are also telling cerebrum, okay, or cerebellum, whatever. So the artery going in the anterior part, we are telling anterior cerebral artery. The artery going in the middle part of the brain called middle cerebral artery. The artery is going on the posterior part of the brain called posterior cerebral artery. Okay, so in this way, these two arteries are the branch of internal carotid artery, this internal carotid artery, and having 80% blood supply. And this posterior part, who is having total 20% blood supply, having they are the branch of vertebral artery or the vertebrovascular artery. Okay, we will see in the image. Now the same thing I am going to show you in the image. So again, yesterday we have discussed the first, the blood is pumped by the heart. So this is the heart. Okay. So the blood is pumped from the heart, and this is the aorta, the biggest artery from of the heart. Aorta. Aorta. So this is the part called arch of aorta. Now from here, I told you the three branches are coming out. Now tell me, what is the name of these three branches? I told you yesterday that I will ask today. These three arteries going in the brain, supplying the brain. What is the name of these three arteries? One is going on the right side, and two are going on the left side. One is supplying the right brain and the right arm, and these two are supplying left brain and the left arm. So there are three arteries are coming out from the aorta. What is the name? This was the homework I given you yesterday. I told that I will ask. So I got how many answers? One, two, three answers. Three, four, five, six. Six answers only. Okay. Six, seven answers. So I told you yesterday, the artery who is coming on the right side called right brachiocephalic artery. The brachio means arm, cephalic means brain. So the artery who supply arm and brain. On the left side, we have two arteries, is 1 and 2. In the left side, we have two arteries. What is the name of these two arteries? Carotid artery and subclavian artery. Now I will show you image again. Just do the imagination very properly and make the diagram. Then you will able to memorize. Okay, let's see the diagram here. So there are the two arteries. We are looking from the front side. One, if the heart is here, pumping the blood, and this is the arch of aorta. So the three artery coming, one is, this is called right brachiocephalic artery. Who is supplying the right arm and the right side of the brain, right side of head? So this is only on the right side, right brachiocephalic artery. Then if we see on the left side, in the left side there are two arteries. Left common carotid artery, or we can left CCA and left subclavian artery. Okay, so they are the left, they are supplying left head or brain and the left arm. Remember now? I'm able to recall? कुछ ध्यान आ रहा है कल का? यस। अब इतना पता तो आगे बढ़ेंगे, है ना? इतना क्लियर है ना एकदम? अभी अभी it is clear now. So we can go ahead and we can learn the next part if it is clear. So just very simple. Look at my here. Heart is pumping the blood. One artery going this side. Now this will supply every part, arm, head, the right side of the head. Only one artery. And the two artery going this side. They will supply head, arm and all. Okay. So there are one here, two here. So there are total three arteries coming out from the aorta. Aorta means biggest artery, है ना? चलिए क्या करिए, एक इमेज बनाइए, इमेज में से एक मोटी पाइपलाइन बनाइए, make them bigger pipeline and make one artery going on the right side, two artery going on the left side. Write down, make it quickly. और तीनों के नाम लिखिए. Right brachio, brachio means this arm, cephalic artery, left subclavian artery, left internal carotid artery. बना के भेज दीजिए, बना के ग्रुप में डाल दीजिए, आप जिस ग्रुप में उसी ग्रुप में डाल दीजिए. Okay. If you follow me, then you will be able to memorize everything. Otherwise, you will forget because this is very complicated. Brain is very complicated until you understand it, and it becomes very easy if you understand it. Okay. Now we will be going ahead. अब हम आगे की यात्रा करेंगे. देखो left side is very smart. The left side is very smart because in the left side there are two arteries. Two arteries. But right side is only one artery. How it will manage? When the left side is having two arteries, right side only having one artery. तो राइट साइड ने सोचा यार ये तो गलती हो गई. The left side is having two artery. I should also have two artery. तो अब इसने क्या किया, लेफ्ट साइड ने इसने भी दो आर्टरी और निकाल दी. So let's see here. Now it become similar. So now you can see here in this image, the left side was very smart because on the left side we have two arteries. One is the subclavian artery. We can see subclavian. This is the subclavian. The name subclavian because it's near the clavicle, collarbone. ये collarbone के पास है इसलिए इसका नाम है subclavian. And another is the left common carotid artery. It's going in the brain. We can see it's going in the brain. Common carotid artery. But right side only one artery. ये तो one ही है, केवल एक ही है. तो अब इसने क्या किया, इसने सोचा यार ये तो गलती हो गई, चलो हम भी दो बना देते हैं. लेट्स मी मेक टू. तो इसने फिर से वो दो बना दी. कौन सी बना दी? subclavian artery and internal carotid, sorry, common carotid artery. यानी ब्रेकियोसेफेलिक आर्टरी बन तो गई थी, लेकिन उसने सोचा यार गलती हो गई, चलो अपनी गलती को सुधार लेते हैं, और इसने वापस बना लिया। सो नाउ वी कैन सी हियर on the right side we have right brachiocephalic artery. Then we have the two branches, right subclavian artery and right common carotid artery. Left side already having this left subclavian artery and left common carotid artery. So what is the meaning of carotid? Carotid artery. Carotid का मतलब क्या होता है? Carotid का मतलब होता है, carotid is a Greek word है ना, there are many words carotid. The carotid artery or the artery, it is a Greek word, और कहते हैं if you press the carotid artery, person will faint. अगर आपने carotid artery को दबा दिया, क्योंकि carotid artery आगे होती है, carotid artery आगे होती है, vertebral artery पीछे होती है. If you press the carotid artery, person will faint. If you go, this is the thyroid cartilage. If you go from here now in depression, you can reach in the carotid artery. Or press vigorously, person might faint, person might dizzy, because the brain supply will be reduced, because carotid artery supplying 80% blood to the anterior and the middle part, and vertebrovascular artery supplying 20% only back part. तो आपने यहां पर दबा दिया किसी को, तो फेंट हो गए, वो फेंट हो जाएगा, अनकॉन्शियस हो जाएगा. द पर्सन विल बिकम फेंट एंड अनकॉन्शियस ड्यू टू द लैक ऑफ ब्लड फ्लो. So the carotid artery is the main supplier of oxygen rich blood to the brain. This is the work of the carotid artery. If there is any blockage in the carotid artery, sometimes there is a blockage in the carotid artery, so there is a poor blood supply to the brain, then person will get dizziness, unconsciousness, even death, क्योंकि ब्रेन की ब्लड सप्लाई तो बहुत जरूरी है. So carotid is the Greek word, the meaning is put to. carotid का मतलब है, क्या मतलब है carotid? एक ग्रीक वर्ड है ना, इसका मतलब पुट टू स्लीप, दबा दो तो पुट टू स्लीप, अनकॉन्शियस. ओके, फाइन. So now we can go till the carotid artery, but vertebral artery on the back side. So let's see here once again in this image. So right brachiocephalic artery means brachiocephalic trunk. We are telling brachiocephalic trunk. Two branches, right subclavian artery and right common carotid artery. But on the left side, left common carotid artery, left subclavian artery. Let's see the subclavian artery. ये देखिए subclavian artery थोड़ा पीछे की तरफ है. The common carotid artery is front side, subclavian artery on the back side. Now I am asking subclavian artery, okay, are you supplying brain or are you supplying shoulder arm area? So we can ask subclavian artery. Okay, oh subclavian artery, are you supplying brain? Are you supply brain? Or you supply arm? So the subclavian artery telling I supply both. Both how? Because you are going towards the arm. Then how you supply the brain? आप तो आर्म की तरफ जा रही हो. Then subclavian artery will tell, okay, I have one branch. Let's see this branch. This is the branch that is called vertebral artery. Who is going in the brain? So now, this is the artery we are talking about. यही वो artery जिसके बारे में हम बात कर रहे हैं. The common carotid artery supply 80% blood to the brain, but this vertebral artery supply 20% blood to the brain. And vertebral artery coming from where? It's coming from subclavian artery. तो देखो ये आगे से 80% हो गया और ये 20% हो गया. So I will summarize here in a very simple word. So again, I will tell you, this is the brain. We are dividing in three parts. The anterior part supplied by anterior cerebral artery. The middle part supplied by middle cerebral artery. In the short, we can write ACA, anterior cerebral artery, MCA, middle cerebral artery. The posterior part of the brain supplied by the posterior cerebral artery. We can write PCA. So these are supplied by the internal carotid artery. They are supplied by the internal carotid artery, or we can tell carotid artery, which is having 80% blood supply, and this is supplied by the vertebral artery, 20% blood supply. So in the anterior part, we are having frontal brain, we are having parietal brain. In the middle part also we are having frontal brain, we are having parietal brain, but also lateral brain. And here we are having occipital brain, back part of the brain. तो चलिए अब मैं आपको ये इमेज के माध्यम से दिखाता हूँ. So what is the frontal brain? What is the parietal brain? Then what is the lateral brain? What is the occipital brain? Let's see here. This is the frontal brain who is in the front side. This is the frontal brain. This is the parietal brain who is on the top of the head. This is the parietal brain. This is the occipital brain who is on the back side. Occipital brain. And this is the temporal brain above the ear. ये हमारा है temporal brain. So first I will tell you, this is the anterior part. We can consider this the anterior part. This is the anterior part. Frontal and parietal. ये हमारा anterior part है. Anterior cerebral artery. Then where is the middle part? This is the middle part. कान के ऊपर का भाग और parietal. Parietal brain and lateral brain means temporal brain above the ear. This entire is the middle part. And this remaining is the posterior part of the brain. In this we are having cerebellum who make the balance and coordination. So this is supplied by posterior cerebral artery. This is supplied by middle cerebral artery, and this is supplied by anterior cerebral artery. Anterior part supplied by anterior cerebral artery in this way. तो आगे के दोनों ये कैरोटिड आर्टरी से आते हैं और पीछे का वर्टिबल आर्टरी से आता है. टिल नाउ इट्स क्लियर. आई थिंक इट्स इजी ना. इट्स नॉट द डिफिकल्ट. ये तीन आर्टरी समझ में आ रही हैं. एंटीरियर मिडिल में पोस्टीरियर. क्लियर ना. सो नाउ what is the common carotid artery, where it supply? I told you it supply 80% of the brain. Okay, let's see now. If you find any difficult, please let me. अरे मैं आपको पीडीएफ दूंगा, सब लिखा हुआ है इसमें, डोंट वरी. जो भी मैं आपको बोल रहा हूँ सब लिखा हुआ है इसमें. जैसे मैं आपको दिखा देता हूँ. स्पेलिंग वगैरह के लिए चिंता मत करिए. सी हियर, ये पीडीएफ में सब लिखा हुआ है. ये आर्टरी, ब्रेकियोसेफेलिक ट्रंक, ये सब आर्टरी, origin, everything is written here. But before giving this PDF, you should understand the meaning, then only this PDF will be useful for you. Otherwise, you will not able to understand, right? So, let's see here. So, we are looking the brain from the front side. So, in the right side, the right side, we are having brachiocephalic trunk, then the subclavian arteries, and the common carotid artery. Okay. So when we talk about the brain, how many arteries are going towards the brain? Brain की तरफ कितनी arteries जाती हैं? Answer 2. 2 arteries are going toward the brain. Look at it from here. You can see in this image, one artery, this is the common carotid artery going toward the brain. And the vertebral artery going toward the brain. Okay. One in the front side, one in the back side. Now they will be going upward. So we can see one is going here and one is going here. So first I am talking about this common carotid artery. There, one is the right side, one is the left side. So we are telling the right common carotid artery and the left common carotid artery. तो हम इसे right और left बोल देते हैं. Okay. अब इसके दो पार्ट हो जाते हैं. देखिए, ये कॉमन कैरोटिड आर्टरी के दो पार्ट हो जाते हैं, एक्सटर्नल एंड इंटरनल. So this is the common carotid artery. Common carotid artery dividing into part, external and internal. The internal is going in the brain. External is not going. External is not going directly. वो और कहीं जाती है. कहाँ जाती है? We'll see. The mainly internal carotid artery going in the brain. So that is called internal carotid artery. Okay, so now the common carotid artery divided into parts. Now the one part we can see this is the एक्सटर्नल कैरोटिड आर्टरी एंड दिस द इंटरनल कैरोटिड आर्टरी। एक अंदर जा रही है जिसे इंटरनल बोल रहे हैं, एक बाहर जा रही है जिसे एक्सटर्नल बोल रहे हैं, और ये जाएगी आगे क्योंकि ये आगे को सप्लाई करेगी। सो नाउ सी, इसको फॉलो करते हैं, इंटरनल कैरोटिड आर्टरी को लेट्स फॉलो। ये आगे के ब्रेन में जा रही है, ये देखिए, ये इंटरनल कैरोटिड आर्टरी की मल्टीपल ब्रांचेस, वी कैन सी एंटीरियर सेरेब्रल आर्टरी, मिडिल सेरेब्रल आर्टरी, है ना, ये एंटीरियर और मिडिल में जाती है। हमने पहले ही बता दिया आपको, एंटीरियर मिडिल में जाती है। एक ब्रांच आंखों को भी जाती है जिसे कहते हैं ऑप्थेल्मिक आर्टरी, क्योंकि आंखें भी तो आगे हैं। सो नाउ लुक एट हियर, सो फ्रॉम हियर इफ यू सी, so when the internal carotid artery coming up, one branch going to the eyes, one branch going in the front part of the brain, one part going in the middle part of the brain, mainly three branches. If anyone is suffering with the problem of eye, means the problem, there is a problem in the ophthalmic artery, means we will be thinking for the carotid system, हम कैरोटिड सिस्टम के बारे में सोचेंगे। ओके, नाउ नाउ कमिंग टू द बैक साइड, इन द बैक साइड वी आर हैविंग दिस वर्टिबल आर्टरी, ये हमारी वर्टिबल आर्टरी इन द बैक साइड। सो वन इज द राइट वर्टिबल आर्टरी, वन इज द लेफ्ट वर्टिबल आर्टरी, दो हैं, वर्टिब्रा में से आती है इसलिए वर्टिबल आर्टरी कहते हैं। इन दिस इमेज यू कैन सी देयर आर स्मॉल स्मॉल वर्टिब्रास हियर, it's crossing the vertebra, so we are telling vertebral artery. Now it's going upward. Now you can see how the vertebral artery going upward. So the right vertebral artery and this is the left vertebral artery. Now this will unite and will become basilar artery. ये मिलकर एक आर्टरी बन जाएगी, इसका नाम है बेसिलर आर्टरी। And this will supply the posterior part of the brain. यही वो आर्टरी जो posterior part of the brain को सप्लाई करेगी। Okay. So now we can see what is the posterior part. The meaning of posterior part, ये posterior part है cerebellum। posterior part का मतलब क्या है? सेरिबेलम, मेडुला ऑब्लोंगेटा, पॉन्स, ये सारे हमारे पोस्टीरियर पार्ट हैं जो हमने कल भी समझे थे। राइट, नाउ आई विल ब्रिंग अ फोकस इन वन टेबल। चलिए अब हम एक टेबल देखते हैं, ये देखिए, सो द कॉमन कैरोटिड आर्टरी डिवाइडिंग इनटू ब्रांच, एक्सटर्नल कैरोटिड आर्टरी and internal carotid artery. Now, internal carotid artery is supplying the anterior part of the brain. It is clear. Anterior part means frontal lobe, parietal lobe. We are going with a very sequence. पहले हमने आपको फ्रंटल बोन बताई, पैराटल बोन बताई, फिर हमने अगली क्लास में आपको फ्रंटल ब्रेन और पैराटल ब्रेन बताया। अब हम आपको आगे आगे बता रहे हैं, इसलिए मैंने कहा कि पिछली नॉलेज जितनी अच्छी होगी आगे उतना क्लियर समझ में आएगा, है ना। द प्रीवियस नॉलेज इफ यू आर गोइंग थ्रू विद ईच एंड एवरी लेक्चर वेरी प्रॉपरली, यू विल एबल टू कोरिलेट क्विकली। Okay, so internal carotid artery supplying the anterior part of the brain. Now, internal carotid artery having two branches. अभी हमने बात की कि इंटरनल कैरोटिड आर्टरी की थ्री ब्रांचेस हमने बताया आपको। One going toward the eye, ophthalmic branch. One going in the anterior brain. One going in the middle brain, middle or lateral brain. So let's see these three branches of the internal carotid artery. So three branches. Ophthalmic artery supplying retina and the optic nerve. Anterior cerebral artery. Anterior cerebral artery means this frontal brain and the parietal brain. And the middle cerebral artery is also the frontal brain, parietal brain, also the temporal brain. है ना ये? तो ये तीन ब्रांचेस हो गई किसकी? इंटरनल कैरोटिड आर्टरी. Now let's talk about the vertebral artery. There are two vertebral arteries, the right vertebral artery and the left vertebral artery, right and left. And they are uniting together, becoming basilar artery. And they are supplying the posterior part of the brain. Okay. So here we are discussing three arteries. Vertebral artery, another side vertebral artery, both becoming basilar artery and supplying the posterior part of the brain. So posterior cerebral artery. Let's see this here. So from the subclavian artery, the vertebral artery coming right and left, they are supplying back part, brain stem, cerebellum, and posterior part of the cerebrum, back part. Then basilar artery, the back part of the brain, pons, midbrain, cerebellum, back part of the brain. Then posterior cerebral artery, this back part. Occipital, in the occipital only we are having visual area. हमारे पीछे तो visual area होता है occiput में. And some part of the temporal lobe. It's a, है ना ये. Okay. For the non-medical student, term might be little difficult. Okay. अभी मैं आपको एक दो चीजें बता देता हूँ क्योंकि हमने क्विज में उनकी बात कही है. स्पीच एरिया कहाँ होता है? स्पीच एरिया होता है यहाँ लेफ्ट साइड में, टेम्पोरल पार्ट. तो कौन सी आर्टरी सप्लाई करती होगी एंटीरियर, मिडिल और पोस्टीरियर? बताइए. स्पीच एरिया फाउंड हियर ऑन द लेफ्ट साइड. So middle cerebral artery supplying the speech area. If the person is having, suppose one person is coming with aphasia, with a speech problem, after the paralytic attack, got some speech disorder. इसका मतलब है कि he has got some problem in the temporal area, means the middle cerebral artery having some problem. There is a blockage in the middle cerebral artery occlusion blockage. Okay. Now, one person is having the problem of the face, the problem of the eyes. चलिए ये बात बताते हैं. If the person is having, we have discussed about the posterior cerebral artery, and we know there is a cerebellum who is connected with the balance and the coordination. Balance and coordination. If the person is having imbalance while walking, so which part is disturbed? Which artery disturbed? Anterior, middle, or posterior cerebral artery? If the person is having the problem of balance, while walking, he is not having enough good balance. So that is definitely posterior cerebral artery. Okay. Now one person is having vision problem, vision issue. What do you think? Which cerebral artery having problem? Anterior, middle, or posterior? Vision problem. So just I told you the vision also there is a vision is area is on the posterior part, but also I told you ophthalmic artery also having connected with the anterior part, right? So the vision problem mostly is having connection with both part, but the vision areas having more connection with the this occipital part. So posterior cerebral artery, okay. But the difference between ophthalmic and posterior we will be discussing. Few things I would like to tell you. If the person is having problem in the anterior part or the middle part of the posterior part, anywhere, the problem is happening on the opposite side. You know that on the opposite side, the problem person is having problem in the right brain, the problem will be in the left body. The anterior part is having very deeper connection with the leg. The weakness of the leg, the paralysis of the leg might happen if there is a occlusion of the anterior part. What is the connection? I will tell you. I will tell slowly because I know there are lots of non-medical students and the lots of new name, external carotid artery, internal carotid artery, vertebral artery, subclavian artery, and all. So sometime it will become too much. Okay. So, but slowly. But if you remember what we discussed today, then the next lecture will be very easy. Otherwise, there will be bombarding. Old name and then new names together will become too much. Okay. In the clinic, you will be seeing many patients coming with the reports, and they are having problem in the right eye, left eye. They are having problem in the right leg, left leg. Okay. One person is suffering with a dizziness. Dizziness is happening most of the time if there is a compression in the vertebral artery. Dizziness. Okay, because the dizziness, imbalance, lack of coordination, this is connected with this. Okay. Now I will give you one quiz. So I will be giving quiz here. I'm posting quiz in our group, the cranial osteopathy group. Also, I will give quiz here in the chat box. I don't know that how many persons are there in the group. I will add all the persons. And the quiz will be on the based of what we discussed today. You have to appear in the quiz within 10 minutes now. It's very simple. Okay. So quiz I coming 1, 2, and 3. Give quiz. You are having 10 minutes. Quickly. I have put in the group. I'm also putting here in the chat box. Click on the link and appear in the group. Yeah, start. And also we're in the final group with the enrolled participants. I'm also posting quiz there. Yeah, done. Do it. 10 minutes maximum. Which major artery supply 80% part, 80% of the brain blood flow? So just we have discussed the 20% supply by the vertebral artery and 80% supply by the internal carotid artery. So the answer will be internal carotid artery. Question number 2. Which artery is the branch of subclavian artery? सबक्लेविन आर्टरी की ब्रांच कौन है? सबक्लेविन आर्टरी से कौन सी निकलती है? तो अभी हमने देखा था सबक्लेविन आर्टरी गिविंग ओरिजिन टू वर्टेबल आर्टरी, इसकी ब्रांच ऊपर जाती है जिसे हम वर्टेबल आर्टरी कहते हैं. क्वेश्चन नंबर 3. द वर्टिबोवेसिलर सिस्टम यानी पीछे वाला सप्लाई अप्रोक्सीमेटली व्हाट परसेंटेज ऑफ द ब्रेन? तो पीछे वाला 20%, इट सप्लाई 20% पार्ट ऑफ द ब्रेन. 4. Which artery supply the lateral aspect of the cerebral hemisphere? Lateral aspect means side. So side means middle cerebral artery. Question number 5. The common carotid artery bifurcate into which two arteries? अभी हमने बताया था कि कॉमन कैरोटिड आर्टरी की दो ब्रांच हो जाती है. देयर आर टू ब्रांचेस, एक्सटर्नल एंड इंटरनल कैरोटिड आर्टरी. क्वेश्चन नंबर 6. विच आर्टरी फॉर्म द बेसिलर आर्टरी बाय मर्जिंग टुगेदर? वो कौन सी आर्टरी है जो मर्ज होकर बेसिलर आर्टरी बनाती है? तो हमने कहा था कि वर्टिबल आर्टरी मर्जिंग एंड टुगेदर एंड मेकिंग बेसिलर आर्टरी. क्वेश्चन नंबर 7. The posterior cerebral artery primarily supply the which part of the brain? Posterior cerebral artery हमारे ब्रेन के कौन से पार्ट को सप्लाई करती है? So the answer is occipital part of the brain. Occipital. Next. A stroke in the anterior cerebral artery may cause which of the following symptom? अगर एंटीरियर सेरेब्रल आर्टरी में स्ट्रोक हो गया तो हमने बताया था कि लेग में वीकनेस आ जाएगी. लेग्स आर कनेक्टेड विद द एंटीरियर सेरेब्रल आर्टरी. बाकी इसके बारे में और डिस्कस करेंगे हम कि विच आर्टरी इज हैविंग कनेक्शन विद विच बॉडी पार्ट. तो ये क्वेश्चन का डिस्कशन अभी दे दिया है, बट लॉट्स ऑफ डिस्कशन इज रिमेनिंग. विच आर्टरी इज हैविंग कनेक्शन विद विच पार्ट? क्वेश्चन नंबर 9. विच आर्टरी सप्लाई द रेटिना एंड द ऑप्टिक नर्व? So middle cerebral artery, ophthalmic artery, posterior cerebral artery, basilar artery. So answer is ophthalmic artery. Ophthalmic artery supply retina and optic nerve. Question number 10. Which part of the brain does the vertebro-basilar system primarily supply? हमारा जो vertebro-basilar system है वो हमारे ब्रेन के किस पार्ट को सप्लाई करता है? Cerebellum and brainstem, which are on the back part, frontal temporal brain, motor sensory cortex, basal ganglia. तो पीछे को सप्लाई करता है. इट सप्लाई द बैक पार्ट. सो आंसर विल बी cerebellum and brainstem. So which part of the brain does vertebrovascular system primary supply? So answer is cerebellum and brainstem. Okay, submit. करेक्ट. अब देखिए अभी भी कुछ लोगों ने नहीं दिया तो मैं क्या करूंगा, आई विल गिव यू वन मोर क्विज. ऑलरेडी 2 क्विज तैयार है. एक 10 क्वेश्चन की क्विज अभी दे दी, एक 10 क्वेश्चन की क्विज मैं आपको दूंगा. वीडियो आई विल गिव यू टुनाइट, मे बी after the next class will over, then I will give you video before 11 o'clock. Then you can see the video tomorrow morning, and tomorrow near about the I will give you quiz in the morning only 9:30. But maybe आपने जब तक वीडियो नहीं देखा होगा, you can give the quiz any time before starting the next class tomorrow. Okay, the quiz will be on the base of same discussion what we have done today. Okay, so see the video. If still you have missed something, okay, and go through with the next quiz, which I will be giving you tomorrow. Fine. So thank you so much. Let's close the session. Now we'll be having next class tomorrow, same time. Closing the session.